Gilead recently announced the results of a Remdesivir clinical trial treating moderately ill COVID-19 patients, and they look quite promising. This and much more on this episode of Biofilm News. Let's get started. Hello, my name is Pavel. Welcome to my channel. Thank you very much for joining me today. Today is a bit of a different episode than I did, say, last time, where I'm just going to go over the couple of news that I picked in my inbox, and I encourage you also to go to these stories and read them yourself. As always, the links will be provided in the description below. But the first main topic of today's video obviously has to do with Gilead, and Gilead, who announced results from its phase 3 trial of Remdesivir in patients with moderate COVID-19. So I've previously actually written a feature article describing various clinical trials that are ongoing for various types of medicines that are aimed to find out whether or not these types of drugs would be effective against coronavirus. And one of them was actually this clinical trial with Gilead's Remdesivir. And as has been reported previously, Remdesivir has actually been granted emergency use authorization by FDA in early May to treat severe symptomatic patients with COVID-19. So this is a follow-up to that story where we see that this open-label study evaluated 5- and 10-day courses of Remdesivir with standard of care or versus standard of care alone, and basically demonstrated that the patients in a 5-day Remdesivir treatment group were 65% more likely to have clinical improvement at day 11 compared to those with a standard of care group, which is really good news and sort of is in line with what they previously reported for severe patients, severely ill patients too. So we will wait to see what the results would be in terms of additional label, quote-unquote, expansion for Remdesivir under this emergency use authorization program. And it would be very interesting to see the FDA's reaction to these results and sort of follow the story as it develops further on. The second news that I came across actually is from Washington Post. It has to do with distribution of Remdesivir in partnership with Gilead and the government, essentially. And basically, there was a little bit of squabbling going on in terms of who should get this experimental drug, which hospitals needed the most, do they have capacity to store the drug at all. And in early May, there was a lot of confusion as to how this drug is supposed to be delivered, where is the shortage of this drug, and Gilead has been working with authorities to make sure that this drug finds the right patients, because obviously it's only been approved for treating severe patients, and the clinical benefits of using this drug are only as good as if you administer it early on in the course of treatment. Also, it has been really determined. And so over time, I think in this article, they've been really going and giving examples of types of issues that hospitals and physicians on sites have been sort of struggling with in terms of making sure that this drug finds the right patient. But it seems that that these things have been actually gradually being resolved over time. Basically, it looks like the donations that Gilead has done with Remdesivir seem to be paying off and helping people over time, especially considering the fact that it is actually promised to expand the access of Remdesivir by donating even more of its supply to this cause. And obviously, if you recall one of my previous stories about Gilead, which actually partnered with other generic manufacturers to license out Remdesivir in many developing countries, which is a really big deal if you want to actually give access to this antiviral medicine to other countries that also have really critical shortages of this drug. The third story, which I've selected today from Healthcare Dive, has to do with postponing care of patients due to this COVID-19 situation. And I've actually hadn't had a chance to look at it just yet, but basically, let's see, it says that nearly half of people that responded to a survey by Kaiser Family Foundation, which is a great source for different types of really interesting coverage on these types of issues in healthcare and pharmaceutical industry. Basically, it says that as a result of the COVID-19 crisis, someone in their household skipped or neglected or put off the care that is required for them due to this COVID-19 pandemic. And they also report that 11% said the condition got worse as a result. And also it says about 32% of those who have postponed care said they would get service in the next few months, and they will do that maybe also at a later time too. So it sort of brings the point really close to home for patients who really need access to medical providers, especially if they're in a context of just having some kind of chronic condition like diabetes or asthma or any kind of other chronic disease that requires medical attention and supervision over time. So obviously the idea of pandemic affecting these individuals more and more, especially now where we start to gradually see reopening, or perhaps not really if you really look at the news, it seems that caring for these people has to be put more and more in terms of a priority for the government, for the healthcare officials in the future, because this is going to have a sort of delayed time bomb kind of effect on the population going forward. So this is a really big deal and big issue that people need to pay more closer attention to. So another story that I found was quite interesting, also from Healthcare Dive, and it talks about the tariffs that just completely are shattering the medical supply chain in the COVID-19 situation. So specifically, it talks about the Purell, which obviously is a famous hand sanitizer manufacturer. In this article, they give multiple examples of types of things that are actually in shortage, frankly, because of the fact that there is this trade war going on between US and China that was not really put on hold per se during this pandemic. And for example, they say that Purell actually requires an electronic input that is actually produced in China. And it seems that in early March, the US trade representative turned down this exemption for the tariff for this specific part that is required for these hand sanitizer dispensers. And basically, only later the decision has been reversed. But actually, other shortages of personal protective equipment in the US are also due to the shortages in the supply chain. And this brings home another message and another bit of news that I also covered previously, talking about larger problems in the supply chain. And potentially the other side of that is actually production of pharmaceuticals that has been a big subject of conversation in the last couple of months, where there's been a big deal of concern about where the active pharmaceutical ingredients are produced. And as I've noted in one of my previous videos, it's definitely a big concern for US government going forward. And there was some other news a couple of weeks ago talking about initiatives that the government has put in place in terms of providing Americans with access to the drugs, to various medicines that are produced on stateside essentially, and not really rely on other companies elsewhere in India, China, or Italy, which are the few of the countries that have the most exports of these key pharmaceutical ingredients that are found in many medications that Americans rely on. This is a very interesting article to get into in terms of the details of specific supply chain disruptions that are really affecting how we deal with COVID-19 pandemic. And the last bit of news that I found from LA Times has to do with the spikes in certain counties that are essentially putting on hold or scaling back some of the reopenings that we have now seen. And this is, I guess, a segue into a bigger issue that obviously I'm sure most of you have been following on the news in terms of the protests, ongoing protests in LA and in many counties and cities elsewhere nationwide. So this is a really, in some ways, can be looked at as a really big deal from the healthcare standpoint, because obviously social distancing measures are not really put in place. A lot of people are not wearing masks, and this may very well be what sets the new second wave of coronavirus going forward into the summer months. And potentially not just being a second wave, but could be a second, tsunami, if you will, of new cases because of thousands of people out there on the streets interacting with one another, really not necessarily exercising, social distancing. And obviously this is a big public health situation that needs to be addressed in some capacity, or at least calculated by the officials, and sort of maybe expected that the number of cases may rise in a matter of days, if not already. So, but this article specifically talks about Sonoma County, for example, which experienced the increase in cases, and I think other counties like Lassen County too. So basically, the idea is that there's now counties that start to experience increases in the number of cases that they report, primarily as a result of reopening of some of the businesses. And potentially this results in this further escalation of the situation. And we just need to be very mindful and stay vigilant in terms of how much tracking and testing is being done. And unfortunately, it seems that with the recent wave of protests, and rightful protests, of course, we may have to be a lot more careful in terms of how do we reevaluate the strategy of reopening. And I think it would be up to the government officials on local municipalities, statewide and nationwide, to really address this potential second wave, or if not a tsunami, of new coronavirus cases going forward. So these have been my 5 news topics that I've wanted to cover today. Thank you very much for joining me today. Please subscribe, hit the like button, let me know what you guys think. I really want to find a nice balance in terms of the types of news that I cover, as well as the format. I'm still learning more about it, and any kind of feedback would be very appreciated. And I look forward to speaking with you soon. Bye-bye.